We are going to see the first part of the duodenum. So it extends, this is the first part of the duodenum. We can see over here, this region is the first part of the duodenum. So it starts from the pylorus region and it extends to the superior duodenal flexure, that is this flexure. Now length is around 5 centimeter, the first part. Let's come to the relations. In front of the duodenum we can see the reflector structures. So anteriorly the duodenum is covered with the peritoneum of greater sac and is related to the quadrate lobe of the liver and body and neck of the gallbladder. Posteriorly it is mainly non-peritoneal. So this is the duodenal region. So posteriorly it is related with the structures passing through the free border of the epiploic foramen, or simply the duodenum. This part of duodenum forms the anterior boundary and floor of the epiploic foramen. So you can remember the relations. So the relations are portal vein, then bile duct, hepatic artery, then gastroduodenal artery, then comes the epiploic foramen. Behind that we can see the inferior vena cava. You can very well see the inferior vena cava over this region. Now above the proximal half of the upper border, this is the proximal half of the upper border. It gives attachment to the free margin of the lesser omentum. This is the free margin of the lesser omentum. On the most posterior plane, the upper border forms the floor of the epiploic foramen, that we know. This canal is the epiploic foramen. Its floor is formed by the upper part of the first part of duodenum. Proximal part of the upper part of first part of duodenum. Then it is related to hepatic artery, the upper border. The hepatic artery will come from the posterior aspect. It passes through the upper part of the duodenum. Then it reaches the lesser omentum, free margin of the lesser omentum. Below, it overlaps the first part overlaps the head and neck of the pancreas. Okay. The proximal half of the lower border of the first part gives attachment to the, that is around this region, proximal half, attachment to the anterior two layers of the greater omentum. Now we are going to see the second part of duodenum. It begins at the superior duodenal flexure around this region, and it is a continuation of the first part of the duodenum opposite to the L1 vertebra. This is at the level of L1 vertebra. The second part passes almost vertically downwards. This is the vertically downwards second part, almost 10 centimeter, 8 to 10 centimeter in length, along the right side of the vertebral column, lodging in the paravertebral gutter. It passes in front of, this is the right kidney. This second part passes in front of the hilum of the right kidney. Then it ends at the inferior duodenal flexure opposite to the L3 vertebra, lower border of the L3 vertebra, where it bends to the left side and is continuous with the third part of the duodenum. Relations, in front it is non-peritoneal in the middle region, around this region where the attachment of transverse mesocolon is there. Above and below the colon, the anterior surface is covered with the peritoneum. So above downwards, the anterior surface presents the following relations. First one, that is not shown in the diagram. In this region, as seen in the first part, you can see the duodenal impression on the right lobe of the liver, sometimes fundus and body of the gallbladder. Then in the middle region, it is related to the transverse colon. Then lower the region, this is related to the few coils of jejunum. Then posteriorly, it is entirely non-peritoneal and presents the following relations. First one, anterior surface of the right kidney close to its hilum. Then the structures in the hilum, that are right renal vessels, then pelvis of the right kidney. Then just medial to that, here you can see the psoas major muscle, so that's also lying posterior to the second part of duodenum. Then right edge of the inferior vena cava, that is the posterior relation. Sometimes a part of the right suprarenal gland comes also as the posterior relation. Laterally, the second part of duodenum is related to the right colic flexure. Now, medially, it is related to head of the pancreas. Then, the arterial anastomosis around the head, that is the ventral and dorsal anastomosis of the superior and the inferior pancreatico-duodenal vessels, which is not shown in the diagram. Now, at this region, the posterior to the first part, the ducts will come, bile duct will come from above, and the main pancreatic duct will come in this region, and they are going to enter into the second part. So they also, bile duct and main pancreatic duct also forms the relations of the second part, medial relation of the second part. Here you can see the interior of the duodenum. So it's very clear that in the first part of the duodenum there are no circular folds. In all other parts of the duodenum you can very well see the circular folds. Also in the second part, specifically the interior demands special notice. They consist of the circular folds, the otherwise known as the plica circularis. Then you have the major duodenal papilla on this region. It is a conical projection arising from the posteromedial wall of the second part and is situated about 8 to 10 cm distal to the pylorus region. This is the pylorus region. From here, it is around 8 to 10 cm away. Its summit presents a single orifice through which the bile duct and the pancreatic ducts open. You can see the bile duct and pancreatic duct in this diagram. Sometimes the ducts open separately into the papilla. Then the minor duodenal papilla, it is a small conical projection around this region, which is not very ill defined. It's present around about 2 cm above the major duodenal papilla, around this region. Then accessory pancreatic duct, when present, opens in its summit. Then you have other features also in the second part. They are the plica semicircularis and plica longitudinalis. The plica semicircularis means they are here. It arches above the major duodenal papilla and resembles a monk's hood. Now, plica longitudinalis is this fold. It is a longitudinal fold, vertical fold extending downwards from the major papilla. Sometimes the anterior fold extends upwards from the major papilla and indicates the intraduodenal part of the bile duct. Now we are going to see the third part of the duodenum, that is this part of the duodenum. It extends from the inferior duodenal flexure to the front of the aorta. This is the vertical line region of the aorta. So if you trace it downwards, this will be the line of the aorta. So that's the extension of the third part. It is around 10 cm length at the level of the L3 vertebra. Then let's see the relations in front. It is covered with the peritoneum in all this region except at the region here, which is crossed by the root of the mesentery. Then anterior surface is crossed by the root of the mesentery, also the superior mesenteric artery and the vein. Now, behind, it is non-peritoneal and related to this region is the psoas major muscle. It is related to psoas major, right gonadal vessels. These are the right gonadal vessels. Then you can see the right ureter. Then you can imagine the inferior vena cava passing downwards along this line. This is the inferior vena cava. It passes downwards along this line. It also comes as the posterior relation. Then a part of the abdominal aorta also comes as the posterior relation. Then above, it is related to the head of the pancreas and inferior pancreatico-duodenal vessels. Below, it is related to a few coils of the jejunum. The last part of the duodenum is the fourth part. It is 2.5 cm long, extends from the front of the aorta to the duodenojejunal flexure, which is lying over this region. This flexure is situated on the left side of L2 vertebra, about 1.25 cm below the transpyloric plane and 2.5 centimeter to the left of the median plane. This flexure is kept in position by the suspensory muscle of the duodenum. In the relations in front, it is mostly covered by the peritoneum. Here is the transverse mesocolon. So the colon and transverse mesocolon will be lying anterior to the fourth part. Then posterior inferior surface of the stomach also lies anterior to the duodenum, which will be separated from the duodenum by the lesser sac. Now behind, you can see a lot of relations which is not going to be seen in this diagram. There are the left crus of the diaphragm, which will come around this region. Now the left psoas major muscle, that is this large muscle over this region. Then the left renal vessels, which is going to pass from the left kidney to the aorta and inferior vena cava in this region. Now left gonadal vessels, these are the left gonadal vessels, and they also pass behind the fourth part, then the inferior mesenteric vein. On the right side of the fourth part, you can see the uncinate process of the, this is the pancreas, and this here will be the uncinate process of the pancreas. That's the right side relation. On the left side, you have the left kidney and ureter. Above, you can see the body of the pancreas. These are the relations of the fourth part.